Residents at this long-term care home were among the first in Canada to get their COVID-19 vaccines.
I feel fabulous.
That was Gloria Laluz a year ago. Now she's had 3 doses and many of her loved ones are vaccinated too.
My kids are vaccinated and my granddaughter's vaccinated, so it's more, with 2 feet on the ground.
But a year later, there are new risks.
Now, with Omicron having the potential risks of evading the vaccine, and the response to the vaccine is worrisome for sure.
This doctor works in long-term care and says even though many residents have had 3 doses, some could still be vulnerable to Omicron.
What we want to do basically to protect the most vulnerable is prevent community transmission. And how do we do that is basically by vaccinating people to make sure they're well protected, and in a way as well by adding some preventative measures.
That's what Ontario is doing in its long-term care homes.
All general visitors will need to be fully vaccinated to enter a long-term care home.
There will also be more staff testing and inside a limit of 2 visitors per resident.
I'd like to have had our family, to get the grandkids and the great-grandkids.
It's forced Karen Palmer to change plans for a family gathering at her father's long-term care home and left her frustrated the province didn't get boosters to more people faster.
I think the message I really want to be known is it just didn't have to be like this.
Dr. Samir Sinha says the new rules are an important barrier, but says so are 3rd doses, especially for staff.
Older adults aren't necessarily as responsive to the vaccine. That's why we need to really look at the importance of getting everybody around them vaccinated, and not just with 2 doses, but also 3 doses wherever possible.
He hopes that could help keep cases among those most vulnerable under control. Alison Northcott, CBC News, Montreal.